Hello, welcome to Nursing with Professor B. My name is Brigitte. I have a master's degree in nursing education. I'm also a family nurse practitioner. In today's video, I will be going over the signs and symptoms of COVID-19. But before we get started, make sure you hit that like button, make sure that you subscribe, and make sure you turn on that notification bell. Let's go. Okay. COVID-19 symptoms. Remember that these videos are purely for educational purposes. Always talk to your healthcare provider about questions, concerns. Made a presentation in regards to the symptoms of COVID in no specific order. Doesn't mean that cough is the number one symptom or fever is the number two. All of these symptoms could be a sign of COVID. Now, the important thing to recognize is that everybody's different. And we all present with symptoms differently. So just because maybe you don't have these specific symptoms, it doesn't mean that you're home free. We ideally right now, we all should be acting right now as if we all have COVID and taking the precautionary measures to not give COVID to others. We should be kind, we should be considerate, we should be compassionate. We should definitely be wearing a mask. So cough is a symptom of COVID. Fever is a symptom of COVID. Shortness of breath or difficulty breathing, so any one of those. Fatigue, feeling very tired. So COVID is similar to the flu in the symptoms that you may get. So you can get the body aches, you can get the chills, you can get the cough. So muscle aches, body aches, headache, new loss of taste or smell. This is one that's very unique to COVID. Usually the other viruses do not make you lose your ability to smell or taste. Sore throat. I can't tell you how many patients I have calling the office right now because they think they have strep. They say, I have a sore throat, right? And they have no other symptoms. Well, a lot of times COVID and every other viral illness can give you a very sore throat. The majority of sore throats are viral in nature and not strep. Strep is also not as common in adults. So a lot of times patients are making appointments thinking they have strep when indeed you could just have an upper respiratory tract infection, which all that means is upper respiratory tract infection is you could have a rhinovirus. Infection does not mean you need an antibiotic. A virus can cause an infection. That's an important distinction. Too many patients go make appointments to the office wanting an antibiotic when you don't really need one. And then it gets into this power struggle. Trust your provider. If they don't think you need an antibiotic, you don't need one. We overuse antibiotics way too much in this country. Another symptom of COVID could be congestion or runny nose. So again, very similar to the common cold. And I mean, your symptoms could start first with the sore throat, then they could progress to the nose, or it could start first with the nose in regards to you don't smell. So it varies for everybody. Others have had nausea or vomiting. Again, not everybody. Diarrhea. So again, most common symptoms of COVID-19, people with COVID-19 have a wide range of symptoms reported, and they can be mild to severe. Symptoms usually appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19 if you have fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, runny nose, nausea or vomiting, diarrhea. This list does not include all possible symptoms. It's the most common symptoms. So thank you so much for watching. If for whatever reason you want a free copy of this PowerPoint, you can email nursingwithprofessorb@gmail.com. All I ask is that you please subscribe to my channel. Making these videos does take a really long time, and I have student loan debt I want to pay off. So hit that like button and subscribe. All right, thank you.